Okay. And how does having autism affect the learning of one child?
Now, you see, interestingly, autism in itself is not a learning disorder, but it does affect learning very significantly. Children who are born autistic may have difficulties in how they process information, and this is not really about how, that they are slow or they have dyslexia or dysgraphia or a learning disorder. It can occur with these particular disorders, but then how the brain of a person has autism processes information is very, very different. And now because of that, then they may have a bit of difficulty in understanding some concepts. So for this particular one, I'm going to just throw in a bit of a scientific fact. There's something called the theory of the mind. So with the theory of the mind, it allows someone to understand pretty much cause and effect. That so let me give a story. You and I are in this room, and we have, say, this plant, and we're assuming that this plant is not this big, it's a tiny little plant. So I put this plant here and then I leave. So when I have left, you take the plant and you throw it outside. So when I come back, I will not know that you threw the plant outside. So when I come and I'm looking for it, I will look for it here where I left it. Now that is, in a sense, when you ask someone that question, where will Zawadi look for the plant? This other person that you're asking the question, where will Zawadi look for the plant? They will say, Zawadi, look for the plant here. Whereas it's obvious, because they know that you took it away, it's obvious for them that I will not find it here. But they will know that I don't know that you took the plant away. So for a person who has autism, they will go where you put the plant. Yeah. Okay. Yeah. And that is the ability to enter and exit someone's world, putting yourself in their shoe. Now you see, that already indicates a bit of difference in how an autistic child will understand the world. They will not be able to put themselves in your shoe adequately. So that will affect how they process, especially social interactions, how they process concepts in school, how they learn. Some will learn very fast, particular concepts. Some concepts may take a bit of time for them to understand. And it's also dependent on the interest. If this child has interest, then they will go over and above, and you will not stop them. Yeah. So if they're interested in maybe the computer, they will go way beyond their age and do amazing things with the computer that a child of their age may not be even in the loop of what's going on. But then you see, it's because of that restricted patterns of interest, and it's very repetitive. Okay, so that's one angle. There's also the angle of how they communicate. So it's difficult to communicate with them sometimes because it's like two people who are talking about the same thing but in different languages. Of course, you won't be understanding each other, and therefore that creates a bit of a stumbling block in school. Some of them may not be, able to communicate their needs, and that also poses a challenge, especially when it comes to social interaction. And we know learning is very social based. Okay, so in that case, then specialized education may work for some children with autism, especially that which is individualized, because the teacher will look into what are your individual needs, what are your interests, where are your strong points, where are the weak points, what can we focus on. But then sometimes, a very integrative education system may work for other kids, because there sometimes it ignites the ability for them to learn how to talk and interact and socialize, but then again it's dependent on the severity. Okay, so the severity is that which will also determine how much of learning may be impacted by the condition based on the symptoms as well. Yeah.
Okay, so for a parent who has a child living with autism, what are the most important phases of therapy that they should consider including in the routine of this child?
Okay, so here again we will really rely on the severity scale. Okay, so now with the severity, that will help you understand which area to work on, which one's not to work on. So always, for me, rule of thumb, you have to have understood 4 areas: what autism is, what it means for your child, what are their symptoms, okay, how does it apply to them, and then what are their strong areas, what are their weak areas. Those 4 things. If you understand those 4 things, then you can easily navigate through the therapies that you'd like to involve your child in. So now there are quite a number, but then there's this particular one that really tends to stand out, which is again an umbrella of therapies all put together, and it's something to do with the applied behavioral therapy kind of thing. So first of all, if the child is having mild to moderate, then working with a speech therapist would do really good, because they can learn how to talk. Bear in mind that our brains are very interesting organs, as I've always said this, because the brain has plasticity. And by plasticity, it means that sometimes when one area of the brain is not doing, it's not completing the function that it needs to be doing, another area can be trained to take up that role. Okay, so especially when the child is really young, then it's very easy for neuroplasticity to occur and for the brain to learn, okay, so this one is not doing what it needs to, so maybe this one can do that. And that would be applicable for especially speech. Okay, and then now there's the aspect or the facet of working with a nutritionist, because there are some diets that do better for autism as opposed to others. Working really well with the occupational therapist would do a long way, because again there's some activities that help the child calm down, and when they're able to calm down, then they're able to learn how to self-soothe and not harm themselves, because you see, sometimes your child may start to have a meltdown, and in trying to soothe themselves, they actually end up harming themselves, like banging the head or scratching themselves, or doing very stereotypic kind of movements. So working with someone like an occupational therapist can help them learn how to use maybe these very heavy blankets, such that when they feel some particular overwhelming emotion, they can just wrap themselves in it, and that will help them calm down. Working with an educational psychologist sometimes can help in navigating through what specialized learning the child requires versus another. Okay, there's a particular domain known as DBTT. So DBTT basically is to do with understanding the weak points of a child and enabling them to develop better behavioral tools. The behavioral tools will now help them more so with the repetitive behaviors, the stereotyped interests. Yeah. So now it helps them to broaden the perspective a little bit more. Okay. Then there's this aspect whereby they can learn. No, that is again dependent on whether or not your child has a lot of hyperactivity. So working with a cognitive based therapist or a psychologist can help the child learn how to regulate their emotions, regulate their their understanding of the world, understanding social cues, dependent again on the severity, because some of these therapies may not work for very severe autistic cases. Now, something really important that I think we also need to underscore is that because of neuroplasticity, some people will say, well, my child was not born autistic, they developed it, or they regressed. They were okay, completely okay, and then at some point they just stopped talking, they stopped doing this, stopped doing that. It happens, and therefore parents need to be very cognizant of how their child is developing. So any form of regression needs to be treated immediately. You need to visit your pediatric doctor and tell them, okay, my child was talking and now I'm noticing that they're not babbling anymore. They're not. So you need to be very keen on what is going on with your child, especially in the event that you have history of autism within the family. Okay. Yeah.
So, the question that came to my mind as we discussed, can you use medicine or drugs to improve the symptoms of autism, or it's just about therapy?
It depends. It depends on many things. So as I had earlier mentioned, there are people who present with autism with high levels of hyperactivity, and for them, sometimes to just get them to calm down, they may be given medication. So it completely depends. Some children with autism may have sleep disturbances, and these sleep disturbances may mean that they don't sleep. And that may need medical intervention. Some of them come with very intensive emotional meltdowns, high levels of anxiety, high levels of low moods, very easily frustrated, especially when the structure is not being followed, when you disrupt or interrupt their routines. So those may need to be medicated. Yeah.
All right. And in your line of duty for the time that you have been, what's the most, I'd like to call it a myth or a misconception that you've come across about autism? What's the one thing that people think or believe about autism that is totally wrong?
Well, the commonest one that I have heard about is that when your child has autism, especially severe autism, that they are mwenda wazimu, they are crazy, because they're not acting in the way that is anticipated or expected. I've also come across the myth that maybe the mom did something wrong in pregnancy and that's why their child is like that, or maybe it's a religious kind of thing. All of those things are lies. A mother may have a relatively normal pregnancy and still end up having an autistic child, because you see the heterogenic factors that you may not have complete control over. Autism is not wenda wazimu, it's not madness, it's not. It's more a condition of the brain. And what happens in that brain is that the brain, the way the connections are made, sometimes it's the processing, it doesn't happen the way a neurotypical would. And because of that, then this child experiences these symptoms. Okay. Sometimes it's said that when a child has autism, they will never amount to anything. That's also a lie. Recent research has found that some of the symptoms that people have in adulthood tend to become a little bit milder. So you may have a child with moderate autistic features, but moving on to their early adulthood stages, the symptoms become more mild than they initially were when the child was younger. So that is also something that researchers are continuously trying to understand exactly what's going on there. But it is something that happens. A person may have autism and still be able to hold a steady job, have a family, live an ordinary and normal, boring, neurotypical life, depending on the severity as well as the support that the person gets.
So that is it for today. We hope you have learned a thing or two. And for me, my takeout has been, it all depends on the severity of your child. That is what will advise the next step that you're going to take in determining the therapy or the treatment or any routine that you are about to set for the child, is it? Yeah, so that is all for today. Remember to leave us a comment and questions. If you want us to host Zawadi for us to discuss another condition, please let me know. I will also leave her details in the comment section and also the directions to her office or her email address, and then you can get in touch with her direct. Until next time, bye.
Okay, bye-bye.